Whitney speaking. Welcome back to another episode of Legal Talk, where law meets justice and advocacy becomes action. I'm your host, Dr. Vickie Simon, and today we're discussing a healthcare emergency they're hoping you won't notice, and why is it being labeled as a market shift? This is not a rise in healthcare costs. This is a controlled escalation. Healthcare prices are not increasing because care suddenly became more expensive to deliver. They are rising because insurers, pharmacy benefit managers, and consolidated hospital systems have learned how to extract more while remaining legally compliant. This is done through narrowed provider networks, higher deductibles disguised as consumer choice, formularies that shift costs mid-year, and premium increases that outpace wages. These are not accidents, they are strategies. The ACA was designed to expand access, but access without affordability is not access. It is just documentation. When people cannot afford to use their insurance, they delay their care. And when care is being delayed, conditions will worsen. And when conditions worsen, treatment becomes more expensive, more invasive, and more dangerous. That cost does not disappear. It gets transferred to emergency rooms, hospitals, families, and communities. This is not a market shift. This is a manufactured pressure system. Now let's be exact about what is about to come. By January 15th, enhanced ACA subsidies are set to expire unless Congress acts. That means millions of Americans who are insured today, millions of people who are insured today will not be able to afford their coverage tomorrow. When subsidies expire, monthly premiums spike immediately. Deductibles become unreachable, and people drop coverage or keep plans they cannot use. This affects people in ongoing cancer monitoring, patients managing diabetes, heart disease, and autoimmune illnesses, parents of children with special health care needs. This is not about the uninsured. This is about the newly uninsured. Coverage loss doesn't happen gradually. It happens overnight. And once people fall off coverage, re-entry will be slow, confusing, and often impossible without permanent harm. Now layer this onto political instability. Congress has released a three-bill funding package, but it is temporary and it is fragile. The threat of another government shutdown by the end of the month is very real, people. Shutdowns don't just affect federal workers. They destabilize the healthcare systems. They delay Medicaid reimbursements. They delay public health grants. They delay hospital planning and staffing. They delay community health programs. Hospitals cannot run trauma centers, maternity wards, or mental health units on uncertainty. Every shutdown threat forces hospitals to prepare for worst case scenarios, cutting services quietly before the public even notices. Healthcare does not recover quickly from political gamemanship and damage compounds. The GOP is trapped in a healthcare bind. Cutting subsidies angers voters. Preserving them angers ideological power brokers. So instead of resolution, we get delay. And that delay pushes risk downward onto hospitals that are observing uncompensated care, onto providers that are forced to treat sick patients later, and onto patients that are navigating coverage chaos alone. This is not theoretical dysfunction. It is operational harm. And healthcare cannot function when policy is treated as a bargaining chip instead of infrastructure. When care becomes more inaccessible, people adapt. They don't stop needing help. They stop trusting the systems. People turn to AI tools, online symptom checkers, delayed or partial treatment, and medication rationing. Tools like ChatGPT are not replacing doctors because people want them to. They are being used because people cannot reach care. AI is not the danger. Abandonment is. Without professional oversight, mental health conditions will worsen. Chronic illnesses will become unstable, and small errors will become catastrophic. At the same time, economic stress, food insecurity, and medical death are driving rising depression and anxiety nationwide. Malnutrition deaths are rising in America not because food does not exist, but because access, affordability, and stability have been stripped away. This is systematic neglect, not personal failure. Now let's confront the most dangerous myth in healthcare. This will not affect me. If you have employer insurance, your premiums are rising because insurers are bracing for an influx of uninsured patients whose care will be absorbed through emergency systems and cost shifting. If you think you have good insurance, here's what stress you have to look forward to. Longer wait times for specialists, fewer in-network providers, prior authorizations overriding clinical judgment, care delayed until you are sicker. Hospitals don't collapse dramatically, they hollow out. First, specialty clinics will close, then maternity wards will disappear, then inpatient psych units will shrink, then trauma centers will go on diversion. By the time communities realize care is gone, the infrastructure will already be dismantled. Hospitals are being forced to treat higher acuity patients with fewer staff, absorb uncompensated care without funding certainties, retain clinicians in unstable environments. Providers are pushed into ethical gridlock, choosing between speed and safety, volume and vigilance. Burnout isn't emotional weakness, it's structural injury. And when clinicians leave, they don't come back quickly. Training pipelines take years. Entire regions lose access overnight. And here's the truth policymakers avoid. When systems weaken, advocacy becomes survival. Patients will have to track their own records, fight denials aggressively, and know their appeal timelines, and demand second opinions earlier on. Those who cannot advocate because of their disability, language barriers, poverty, and mental illness will suffer first. That is how unequal systems sort people out. Silence does not protect you, it removes you from the decision making process entirely. This is the inflection point. January 15 is approaching. Funding is unstable. Coverage is shrinking. Costs are accelerating. If this moment passes quietly, collapse will be normalized. Hospitals will close without headlines. Deaths will be dislabeled as natural. And mental health crises will be treated as personal failure. This is how systems fail without alarms. Urgency is not panic. Urgency is clarity. This question is not whether the crisis is coming. It is whether people will recognize it before it becomes irreversible. If today's episode moved you, organize. If it informed you, share it. If it challenged you, plan. And if it reminded you that power lives in people, act. When fear breaks us down, strategy builds us back up. Legal talk is not just commentary, it's resistance. It's a call to action and a reminder that justice doesn't just come from silence. Thank you for tuning in to Legal Talk today. I'm your host, Dr. Vickie Simon. I love you, and I'll see you on the front lines of reform. Until next time, stay informed, stay ethical, and keep serving your community.